Good morning you guys, it's Karen and I am doing a video diary of my Plexr treatment for hooded eyes. It is known as non-surgical blepharoplasty. So blepharoplasty is something that I had considered. I'd almost booked the date, I'd had the consultation, etc. And then for one reason and another I didn't have it done. I then heard about this treatment and I went to see Dr Bong in Glasgow at Essence Medical, and I just knew that this was the treatment for me. So I have had one treatment so far and I can feel a huge difference in my eyes. I've got lots of before and after photos, and day one, day two, day three. I had it done a week ago today, so this is a week later, but the video will start obviously with me the day before having the treatment so that you can see my eyes. And like I said, I've got lots of photos of before and after. I would highly recommend Dr Bong. He is very down to earth. In fact, I have an interview with him that we did. He's also done my Botox before, so I will insert that video for you. I will insert a link in the description for you in case you want to see what he's like. And he also has a video himself on the Plexr treatment showing how it works. So yeah, if you would like to hear all about the Plexr and watch my video diary of the treatment for over the last week, then please keep watching. I just wanted to come and do the before of my Plexr treatment, or the kind of introduction if you like. So this is going to be a diary and review of the Plexr treatment. And Dr Bong, who's doing my Plexr, has told me that it does sometimes take 2 sessions before you see the results, depending on the level of your eyes, depending on how your pain tolerance is, because there's 3 different levels they can do when you're actually in the clinic. So I'm hoping he can do the highest level and that I can tolerate the pain if you like, but if he can't, then it might mean I need a second session. But I'm doing this on the 1 session. I'm going on Friday, so today is Tuesday, so I have a few days to go. There's nothing really you need to prepare for other than don't use retinol around your eyes. So as long as you use it above your eyebrow and like here but not near your eyes, then you're absolutely fine. So I've not to use any retinol near my eyes until then, and then on the day don't take any aspirin or ibuprofen because that will make you bruise more. So I believe on Friday that I'm going to be there for about an hour, and I think that I know that I'm going to have rows of little brown, they look like scabs, they're not actually scabs, but they look like scabs, and you can wipe them off, but the idea is to keep them on for 3 to 5 days. And this is another way that you affect how well the treatment works. If you keep them on for the full 5 days, then there's a better chance that the treatment will work. If you wipe them off the following day, which you can do, there's less chance of the treatment working. So I'm going to try to keep them on. I'm going to try to go around in my sunglasses. And like I said, I think I'm going to be there for an hour. I am going to make sure I do take paracetamol because I know that it will be painful, and I'll be taking my pain medication anyway. I will probably wear a simple eyeshadow like I have today, and then just, you know, he can wipe it off or I can wipe it off when I get there. I believe that my eyes are going to be swollen and bruised, so the next time you see me in this video, I imagine I'll have those brown spots that look kind of like, they look kind of animalistic, like, I don't know, hopefully it will look like that anyway, because they're very symmetrical rows of little, it's almost like you've got eyebrows in the middle of your eyes. But I believe also there'll be a lot of swelling and a lot of bruising around my whole eye area the following day. I've done a video talking about this whole treatment, explaining exactly what it is, so I will link that for you below, and you might want to kind of stop this and go and watch that first to give you the information of what it is, or you might just want to watch that afterwards. It doesn't have to be in order. You can watch this as the experience, and then you can get all the information about what it actually is and how it works in that other video. Each treatment is £350, and he recommended 2 to 3 for me. It may be different for you depending on how much loose skin you have. You may be recommended 1 treatment, or like me 3, but you certainly get results from 1 treatment. So I've definitely got results from just 1 treatment. So it is something that you can have 1 done and see how you feel, have the second one done, see how you feel, that kind of thing. So I thought I'd come and stand by a window so you can see it. It just looks like bad eyeshadow. Was nowhere near as painful as I expected. In fact, I'd barely call it painful. Threading is more painful than this because you've got anaesthetic on. What did really bother me was the smell, this burning smell of the anaesthetic with the heat. People think it's your skin, but it's not. But that wasn't a pleasant smell, so I needed a gauze. So I did this eye second, and I put a gauze over my nose, and that was much better. Now it is very, very stingy and feels like the skin's off a bit.
feels like it's been grazed, you know, like somebody's, you know, when you graze your knee, that's what it feels like. My eyes have been grazed, so they are very stingy and sore. I've got some cream. This is a steroid cream that I'm to put on, I think he said 3 times a day, and I've not to touch these little brown crusts for 5 days. I can cover them with mineral powder in 3 days, so for 3 days it's going to be keeping my shades on. Like I said before, he said he would recommend 3 treatments for me before we saw a real difference. But I can see my lids already, which we couldn't see before with me.
Hey you guys, so this is my first video. I wasn't actually going to do this. I was going to do it tomorrow, which would be day 2. Today is when I've had the treatment on my eyes, and I was just going to put my Snapchats in. I might well put my Snapchats in anyway, so you can see it immediately after, because I think that it's actually lightened up a bit. I think all these brown dots have lightened up a bit since my treatment earlier today. The reason I wasn't going to do it today is just we ended up getting stuck in traffic for 3 hours on the way home, and I've got a bit of a, it's not yet a migraine, but I've got that feeling of one coming on, and I've got a headache, and I was just like, oh, I don't feel like it. But actually I don't feel too bad now, and I thought, well, I'll just pop on and show them what it looks like being as it's lighter, but also I can already see a result from this, and I'm absolutely delighted. I really am delighted. So what will I tell you? So I went in, and what happens is you go in and he puts anaesthetic cream all over my eyelids. So I did put a picture of that on Snapchat, but I will put a picture in here for you to see what it looks like. But you basically just get anaesthetic cream all on the upper part of all over your eye, except for this bit of your lid here. Then you sit in the waiting room for 20 minutes, which I did, and then get called back in again, and he wipes the cream. He wiped the cream off my left eye and left on the right eye, because obviously the longer it's on, the better. And then got started, and it literally, the treatment only took, I would say it was 5 minutes per eye, maybe a little bit more, but I don't think so. So he started on this left eye. He started off by just doing it once and saying, can you feel it? And I said, no, I can't feel anything at all. And he does it quite aggressively. He says, I think there's 3 levels. You can have it on like low, medium or high, and he does it on high. And so he does that because he likes there to be a better result for us, which is absolutely fantastic. He did say though, and I think I said this in Snapchat, that he would recommend 3 treatments for me. So we'll see what it's like once this is healed, but I'm already booked in 6 weeks time to go back and have this done again. So it started, and I could feel nothing for about the first, I don't know how many little bumps is there here. Let's count. There's about 200 here. 200 little dots on my eyes, and I suppose for about the first 10 or 20 I couldn't feel anything. And I said to him afterwards, it was on a sliding scale upwards, that it did start to feel, I could feel it, but it wasn't painful. It was just like a tiny bit of heat. You could feel the tiniest bit of heat, like somebody was poking you with a tiny little hot thing, and just going like that, and it wasn't long enough for it to bother or to go, oh, that's painful. It got a little bit painful for me on the outer bit here, but that's because he said the anaesthetic hadn't gone that far as he's gone on the outside. So there probably wasn't any anaesthetic there. And as well, what he said was, you put the anaesthetic on, but by the very nature of us having hooded eyes and sort of wrinkly eyes, when you're sitting in the waiting room with your eyes open, it can go into folds, and then there can be bits of skin that it's missing, you know. But he kept checking that I was okay, which was wonderful. You know, he kept saying, are you okay? And he told me if it gets too painful to make a sound, basically, and he would stop. But it just didn't get to that stage at all. The only thing I found was the smell of burning was bothering me. There was sort of a smoky smell. It's not the smell of skin. He said most people think it's burning skin. It's not. It's the combination of the heat with the anaesthetic cream. It creates a horrible smoke smell, and that was kind of catching in my throat and in my nose, and I don't know, for a minute it made me feel a bit claustrophobic. So when he'd done the one eye, I asked him if I could just have a piece of gauze. Well, actually I asked him if he had one of them masks or something that I could put over my nose, and he gave me a little piece of gauze. So I just put that over my nose while he did the right eye, and that made all the difference. It meant that I wasn't like concentrating on that horrible smell. My hair's all, you see my hair's all wonky because I actually had my hair kind of up and away so that he I had it like that, and I'm going to put it like that again. Put it away so that he could get more easily to my eye, but I don't want anything kind of touching my eyes because even the wind has kind of hurt them. What was I saying? So he gave me the gauze, yeah, because the smell was bothering me, and he started on this side. This side, for some reason, was much more painful for me. This side is worse. He took before pictures and showed me, and actually this eye is much more hooded than this eye. But that doesn't really mean anything. He said it just means that it will take a while for them to be evened out, you know. But yeah, this eye suddenly started feeling a bit more painful, but it was still not unbearable pain. It was actually more like, I was trying to think, how can I describe it to you guys? The first thing I thought was, it's less painful than threading. If you've had threading done in your eyebrows, I think it's less painful than that. Threading for me was unbearably painful. Like my eyes were watering when I had threading done, and I had it done twice. The first time I didn't know what I was in for. The second time I had it done for my wedding because I loved the results. But I haven't had it done since because my eyes water, my eyebrows are all red, and I found it really painful. It wasn't as painful. It was more like, you know the feeling of tweezing your eyebrows? It was more like that, but say times, like as if there was 3 being pulled out at a time. But it was more like, it wasn't even that painful. It was more like an itch. It was like as if there was an annoying little vibration hitting you like that, and you wanted to go, oh, get off, you know. It felt like a little insect that I wanted to go, get off me, you know. That was kind of hard because I was lying there thinking, oh, you know, and it was even tickly. Like at the top bit here, it was very tickly because it was a very, very light feeling. Because bearing in mind, this device doesn't actually touch your skin. You know, it does obviously penetrate, but it doesn't touch your skin. So it was a very, very odd feeling, but definitely not painful. And that was something I was worried about because you never really know whether you've got a high or a low pain threshold. I don't feel like there's any way of knowing other than maybe if you had a friend that went through the same operation as you. But even then, everybody's got different chemical makeup, you know, so I don't know whether I've got a high or low pain threshold, but I would say that was, having my tattoo was more painful, threading was more painful. I don't wax my bikini area, for example, because the thought of it makes my eyes water. I will wax the bit that you can see front on. Let's just put it that way. But anything too close to the special bits, oh my goodness, not a chance. That's too much. And in fact, I had my underarms waxed once and they bled, and that was just excruciating. So I'm just giving you these examples to tell you the kind of things that I find painful. What else have I had done? Botox was more painful than this. But I suppose Botox doesn't last as long. You know, you haven't got somebody doing that over and over and over again. You've just got like one injection. But the Botox around my eyes, I'd rather have this done any day than I would having the Botox where I have it for my crow's feet here. That to me is painful. Having my lips done, way more painful than this. Having the fillers in my top lip, way, way more painful than this. So yeah, that's where it's at pain-wise. So like I said, it took probably 10 to 20 minutes for the actual treatment, and that's you done. He reckons 3 treatments, so I'm going back in 6 weeks. And so what happens now is I've got 5 days of keeping these brown, they're called crusts. They're not really scabs because my skin hasn't been injured on the top layer. I will give you a close-up in a moment, but I have to try and keep these on. So if you rub hard enough, then they will come off. But the idea is to keep these on for 5 days and you'll get a better result. So I'm going to try everything I can to be gentle. The problem is I did put mascara on this morning and it has gone up here. I think it's where I put cream on, so I'm going to have to gently wipe over them and just desperately try to not get those brown lumps off. Brown crusts, he calls them. I'd like to think of a better name for them because I don't like that word. I think that's horrible. So he said, let's see, he didn't tell me about any pain levels afterwards. He just said that it will be red and swollen over the next 5 days. Well, 3 to 5 days. So tomorrow morning, he said, when you wake up, you will most likely have swelling under here because it will have pulled, and that makes sense to me, you know, from lying down. But once I start moving about and moving my eyes, that should dissipate. But there will be a lot of swelling tomorrow. There will also be a lot of redness. And he said, because he's so aggressive, there will be more swelling than if you only had it at a mild level, you know. But to me, if you're going to pay for a treatment like this, you should get it done at the highest level you can bear, you know, to get the best treatment, because there's not different prices for the different levels. So leave these on. So basically just try to gently wipe them with water, but very, very gently, like I said, so as not to wipe the crusts off. And then after 5 days, he said, as you're sort of doing your, you know, gently cleansing, they should come off anyway, as long as you're being gentle, they'll come off of their own accord, kind of thing. And then you're left with redness, and that redness should last, it should last a couple of weeks. It could last less than that. It could last 6 weeks. It just depends on the individual. But I don't think anybody would be bothered about that, because most of us having this done would wear makeup every day anyway, wouldn't we? And I certainly wear makeup every day, so I don't care about any redness. He's given me this, which I'm holding because I'm going to put some more on, which is a steroid cream, which normally you shouldn't use steroid cream on the eyes, but you can. It's just that you should only use it temporarily. And he said to me, you know, do not use this for more than 5 days. So I'm going to put this on, I believe it was twice a day. I can't remember if it was twice or 3 times a day. I think it was 3 times actually. I think twice a day is in my head, because I've also got a steroid cream for Watson, my dog, because of his skin condition. So I think I had the two times a day in my mind then, and that's just to help with the redness and the swelling, etc. So I think that's everything to tell you for now, but except that, the results, I think I'm already delighted, and I don't know whether this will get better, the result will get better, or whether it will relax a little bit. I don't know, because it feels very, very tight. This whole area feels very, very tight. And I don't know whether once it heals a little bit, that will relax a bit. But I am friggin' delighted, because I can see the top of my lid, and it's been a long time since looking forward as I am now that I can see the top of my lid, and I just think that that's wonderful. And that's not like when I raise my eyebrows, which I can do a bit despite the Botox, I can see them even more, but even without lifting them, I can see my mobile lid. And bearing in mind, he was saying he didn't expect drastic results on me until the 3rd treatment, because, well, he said you'd see more results at the 2nd treatment. He said, because I've got a fold of skin, because mine are quite severely hooded in his opinion, you first need to get rid of the crease line, and then you tighten the skin that is loose. So you get rid of the fold, and then the 2nd stage is to tighten the skin. Yeah, I can already see a difference. I feel like my eyes look more wide open. I don't usually like myself without makeup on my eyes, and I've got just a little bit on the bottom of my eye there. Yeah, I really like this. I think that my eyes look much wider, and I think that's the problem. Bizarrely, I know that everybody says that the eyeliner makes my eyes look smaller, but I think it makes them look more sharp, you know, whether they look smaller or not. I think it makes them stand out, and I'm used to it, you know. I'm very used to seeing eye makeup on myself, but actually today I thought, no, I kind of like that. So yeah, if this is what it's like now, imagine what it will be like after treatment too. But like I said, we'll see what it's like after 5 days. The other thing to tell you though is that it was very painful afterwards. So I left, and that's what's in my little Snapchat things that I will have put them in here somewhere, or I'll put them in at the end. It was stinging after I left, literally about 5 minutes afterwards, like when I got in the car. So I left the waiting room, did a couple of pictures in the waiting room, left the waiting room, did a little Snapchat outside the waiting room, went down and got in the car with Kev, and we went off to lunch. And as soon as I got in the car, I said to him, oh my goodness, it's so stinging. I just wanted to put ice packs on my eyes. You know, they were just, it's like I had grazed it. It's like I'd got a razor and scraped the skin off. So what I did was I put some of this cream on, and that seemed to help, and it sort of subsided for about 10 minutes. But then when we got out and we went to lunch actually, it was then hurting again. And I said to Kev, I think what it was the wind. It was very, very windy. And although that felt very lovely and soothing on my eyes, when we then got into the restaurant where we went for lunch, I think that because that was kind of pressure against them, that had sort of irritated them, and they then were stinging again, and that didn't help. So then I took painkillers, but that didn't seem to do anything at all. I took painkillers not for that, I took that for my joints, but that didn't seem to do very much at all. Whereas now actually, right at this moment, which is, let me think, it's 5 to 6 just now, I had this done at 12 o'clock. Well, no, actually it was about 1 o'clock. By the time I'd got the anaesthetic and everything, it was just before 1 o'clock. So 5 hours ago, and now I feel absolutely nothing, but this has only calmed down, and I feel nothing within the last half an hour to an hour, because even being in the car with Kev, I was saying, no, it's still feeling prickly. It just feels prickly. It's as if I've got a prickly heat rash or something on my eyelids. It wasn't as intense as it was at first. And I've got a headache, but I don't think that's anything to do with this, unless it's to do with maybe I was tensing while he was doing it or something like that. So that's pain-wise, but like I said, I don't know where I am on the pain scale. And the other thing to say is I took my sunglasses with me and hoped that it was going to be a sunny day so that I could wear my sunglasses kind of wherever I went. Thankfully, I didn't have to get the train because Kev was there to take me home. But I felt a bit silly with my sunglasses on inside. And I said to Kev, what looks worse, me with my sunglasses on or me with this on? And he said, oh, I don't really think either. He's not somebody that's embarrassed by things like that. And he said, you always see people wearing sunglasses inside. So he wasn't bothered. So I put my sunglasses on thinking that people would stare at me, because at the minute, looking in here, it doesn't look too bad at all, but this was very, very dark brown when it was first done, and it just looked like a really bad eyeshadow on my eyes. But my sunglasses, I just felt uncomfortable in them, so I took them off. And I have to say, I didn't notice one person staring at me, and I would be acutely aware of that, definitely. I'm that type of person that's always aware of people staring at me. I remember when I was in a wheelchair, I really felt it, you know, when people were staring at me. And funny enough, they stared at me more after my leg cast then came off, because obviously when my leg was up they could see exactly what was wrong with me, and then after that it was almost like, oh, I wonder what's wrong with that, you know. So yeah, I didn't see anybody staring at me. So we sat in the restaurant and had lunch, didn't bother me at all, absolutely fine. So I think that's everything to tell you now. Let me show you it close up. Okay, so this is it close up. Kevin was just looking at it when I got in the car and he was like, very, very weird, isn't it? I'd said to him that I might look swollen, but that it would look like something from, this reminds me of Star Trek. I just think I look like a Star Trek extra. I can't think what exactly I mean, but there's something in those films where they've got like little dots, you know, and that's what it reminds me of. So you can see it doesn't go all the way to my lid. But do you see what I mean about looking forward? You can now see some of my lid, and you couldn't before. So I am going to take some pictures now and hopefully have a little before and after, but it'll be sort of the effect in a couple of weeks when this is properly healed. That'll be interesting to see. That's some close up. I did ask Dr Bong if he could do my lid. You know, I was like, can you not go all the way down to the lid? Because although it's mainly the hoods, a lot of it is to do with tightening the skin. That's what I want. My skin is very crinkly, and even on my lids, when I put an eyeshadow on, I used to be able to go over and the skin wouldn't move. I do it now and you can see like the skin crinkles up, or maybe, I don't know whether you can see it, but I'm sure you know what I mean. It's crinkly that way, you know. And he said he definitely can go further down and do closer to the eyelid, but the problem is, because he's quite aggressive, he said this swelling, if he did it on my eyelid today, he's worried that the swelling is going to frighten me, because he said it quite a few times, like, don't worry, don't be frightened by the swelling. If you wake up tomorrow with swelling, don't worry, that will go down in a few days. And with it being on the eye, it can mean that you can't fully see, you can't open your eye completely, and that might be quite frightening. But I think I'm going to say to him next time, he said this, he said next time you come in, you'll know what to expect, you've had it, and if you are feeling a bit more brave, then we'll go further down. And I definitely feel like, yes, next time I go in, I'm going to say, yes, go further down the eye for sure. The only thing with that is I'm going to have to ask Kev to take another day off, because I definitely wouldn't want to risk getting the train in that situation, you know. Morning you guys, it is day 2 and I'm going to make sure I do these videos close up so that you can see exactly what is going on with my eyes. So I had the treatment yesterday and as you can see I look very, very swollen, so I wanted to show you that. That's really the only thing there is to show you today. I wasn't in any discomfort at all during the night. The only thing that happened was every time I turned over I would move my head on the pillow and I kept thinking, oh, I was worried that I had taken these brown crusts off because you're supposed to leave them on. But when I looked at it this morning, I hadn't. They're actually a bit more hardy than I expected them to be. I expected them to be bigger, and I expected them to be really on the surface and kind of precarious. And so if you kind of touched them in any kind of way that they would come off, but they're not. They're a little bit more hardy than I expected. So after I finished talking to you guys yesterday, which was only 6 o'clock last night, I had a shower and I used a very soft flannel. It was the black face cloth, that's the Magic face cloth. I can't remember the brand, I think it might be Sephora. It's just a black square. It's very, very soft and not too fluffy. So I wet that and I just gently sort of almost patted across my eyes, but I had some mascara, do you remember, up there, so I got that off just by being very gentle, and then I put some more of the steroid cream on, and since then no discomfort at all, let alone pain. Not even any discomfort is what I mean. That didn't really make sense, you know what I mean? Absolutely perfectly, like I said, I didn't wake up with any discomfort. I opened my eyes and thought, oh, I thought I was supposed to have really swollen eyes. They don't feel swollen. They just didn't feel swollen at all. And I sort of went like this under my eyes, because what he did say to me was that it would pool underneath here and that I might have swelling underneath here, but I don't see any swelling under my eyes. So I thought, well, I can't feel anything. It doesn't feel like they're that swollen, maybe a tiny bit, but I'll go and have a look in the mirror. And then you look in the mirror and you can see that, yes, they're definitely swollen. But I can see that it's actually this upper lid that's swollen, and that I can still see my lid, you know, so I'm still delighted. It's nowhere near as bad as I expected it to be. I expected to look much more, I don't know, like I'd had a beating or something, and I just don't look like that, you know. So I am going to wear my sunglasses today if it's sunny, and if not, I'm just gonna not wear anything, because we're going for a walk. I will be taking Watson for a walk along the beach. I will be taking him for a play date later on. The people I'm meeting know what I've had done, so they won't be shocked or anything at my eyes, but I feel absolutely fine. There's no issues at all. I'm slightly concerned about tomorrow. Tomorrow I'm grooming a dog, and I'm just worried about like the little hairs getting in to the area and making it itch, you know, and me wanting to touch it, because I feel like I wouldn't want anything in that area. It still feels a little bit, I don't know, tender's the right word, or a little bit, like I said before, like it's been grazed, and I just wouldn't want to touch that area. It doesn't feel 100% normal, but like I said, not painful in any way. Well, you guys, it's day 3, and I thought I would come and give you an update because I can see a difference in my eyes today. They are slightly worse in that they are more swollen, and I will give you a close-up in a moment, but you'll hopefully be able to see in both corners, but more so in this corner. It's very swollen, that it's kind of pushing into my eye, but also underneath these brown dots it's very red. So I don't know whether you'll notice the difference today from yesterday as to whether they look darker brown almost from a distance. You know, they're not quite as light as they were. They don't look terrible at all, but they're definitely, I can see the redness under the skin, under these little brown spots. I can see the redness. And also this morning they were stinging quite a bit. I put some of the steroid cream on. I wiped over them very gently with micellar water, and then I put some of the steroid cream on, and they're not stinging as much now, but they still feel a little bit exposed. Okay, so this is them closer up. So do you see here, it's maybe easier to see if I turn to the side, but it's kind of, you know, pushing on my eyelid a little bit. So I think you can see closer up here that they are definitely darker than they were before. I'm not sure if any of these brown dots have come off, because he did say that if you aggressively wiped your eye, that you could take them off. In fact, he didn't even use the word aggressively. I can't remember how he put it, but I have been wiping over my eye because obviously I want to clean it, and I've been using micellar water or a soft flannel, and it looks in some places like it looks a little bit sparser there, and so I don't know whether they've come off, because it's actually quite hard to tell. I don't think so, but we'll see. They're supposed to naturally come off at day 5. Being like this on day 3, I would say to make sure that when you have your Plexr appointment, to make sure that you've got a free week, a free 3 days at least. More would be better if it could be 5, where you don't have to meet anybody or, you know, anything like that, because like today there's nothing I can do with this. I've got a somebody coming to get their dog groomed. I'm not going to put sunglasses on in the house. I can't yet put mineral makeup on it. I can do on, so let me think, 3 days, Saturday, Sunday, Monday. So on Tuesday I could put some mineral makeup on this and at least maybe cover it up, but I'm not sure what it's going to look like with mineral makeup on it. And obviously it's still going to be swollen. So I would try and make sure you've got nothing going on for the week after the appointment. Good morning, you guys. Today is day 4, isn't it? Yes, day 1 was when I had it done, which was Friday. Day 2, Saturday. Day 3, Sunday. Day 4, Monday. Yes, today is Monday. And it's a really quick one today. I said I would only come back and tell you if anything had changed. I feel like the swelling has definitely gone down, because in the corner of my eye is not that big bit of swelling that's kind of obstructing my vision. I mean, it isn't obstructing my vision, but I could kind of see it in the corner of my eye. So the swelling has definitely gone down already today, which I kind of I was surprised at actually, because I think the swelling was to last, oh, I suppose he said 3 days to a week. It just depends on the individual person. And I always assume that my things will last me longer, because they usually do. So yeah, I'm happy and surprised that the swelling has gone down a bit. I think they are definitely, they're darker brown now because they're red underneath. I don't think any of the red, the brown bumps have come off, or spots, or whatever you call them, but it's hard to tell actually, because there is an area here that's quite smooth, and I can't tell whether any have come off, but I'll give you a close-up now. So this is the close-up. I don't think looking at it, it looks any different really than yesterday, and I might watch this back and not include it, but yeah, like I said, I don't think it looks much different than yesterday. If anything, it looks a little bit darker brown, because the brown is still there, but underneath it's a bit redder, so I think it's just making it look a bit odder. Good morning, you guys. So it is day 4, I believe. Is it 4? I had it done on Friday. So it's kind of day 4 or 5. I'm never sure which, whether do you call the day you had the treatment, since I had it at kind of lunchtime, day 1. I had it on Friday, today is Tuesday. So Saturday, Sunday, Monday, Tuesday. It's either day 4 or 5. And this is the day I am able to put on mineral makeup. So I left it completely without anything on Saturday, Sunday and Monday. So 3 full days without any mineral makeup, just leave it to heal. But today I thought, you know what, I do want to put some on. I was going to leave it for the 5 days because the crusts are supposed to come off, but it's not like, you know how sometimes with the scab it's very obvious. It's not very obvious. They're actually so tiny that you can barely see them, and I'm struggling to know whether some of them have come off. Some of them you can see they're sort of starting to peel, or it almost looks like sunburn underneath this, but it doesn't look that much different to yesterday. So I thought I'd come and do the video with the mineral makeup on, so you can see what it could look like on day 4, you know. So yeah, like I said, it doesn't look any different at all underneath. It's still red, still as red as it was yesterday. It's still kind of darker brown, so a little bit more obvious. It's not sore. It still just feels like a little bit of a graze, a little bit of a cut. The only thing is I can see there the mineral powder kind of creasing, so I'm going to have to maybe use a cotton bud or something to sort of even that out. I don't know. I'm not sure how that's going to hold up for the day. I'm not doing anything major. I just wanted to see what it looked like with the mineral powder on, so we'll see how this holds throughout the day. But that's, to me, has certainly made it more, it's made me more comfortable not wearing sunglasses, because it definitely just looked like an odd eyeshadow, and being out for the day yesterday, not meeting anybody, was absolutely fine. But today my dog walker's come in, and I just thought he's not the type of guy that I would explain it or tell him what had happened, and I know that it shouldn't matter, but I would be self-conscious that he'd be thinking, what on earth is that eyeshadow, or what's she got on her eyes, you know. So with this, I just feel much more comfortable. I've also got the guy coming to look at the gas boiler. I'm meeting my dad and probably some friends in the park later. So there's a few things going on. So I'm really happy that I can get some mineral powder on it. I think that you can now see a difference. Even with my eyes completely relaxed, which is now, you can see my lid, and I don't believe that you could see my lid before. So I am beyond delighted with this, considering I've got another 2 treatments to go, which should, you know, make things much better. So I'm really, really delighted with it. I'm so glad I didn't go for the eye surgery. I was going to have the actual Blepharoplasty, and I think that would have been a much more intense recovery. It might have been a bit, well, it will have been a more intense result, but I think this is going to be the result I want anyway. It just will, obviously there'll be a longer time in the end because it's 6 weeks between treatments, so it's going to be 18 weeks before I get the final treatment. But yeah, I'm glad I'm doing it this way, and I'm really happy with it so far. I thought it would be useful for you to just see a little close-up of what it looks like with the mineral powder on, and as you can see, it is gathering in that crease, but I think that's okay because I'll have my eye open like this most of the time. You're not going to see the crease. Hey you guys, I thought I would pop on and show you what it is like now. This is I get confused with these days. So Friday, if we call Friday the day I had it done, day 1, day 2, day 3, day 4, day 5. This is day 6, so it's Wednesday today. I had it done on Friday, and this is the day that all of the brown scabs are supposed to come off, and they didn't come off They come off just a minute ago, and it is probably, I think it's about 6:30, something like that. So it was kind of as the day went on. When I woke up, they were all in that sort of peeling place, you know. So although I did cover it up, it was a little bit difficult. And I'd say that day 5 and day 6, even though you can cover it up and definitely go out without your sunglasses on and not be stared at, you wouldn't want to be going anywhere. Certainly wouldn't be wanting to go on like a first date or anything, you know, or anywhere where somebody is quite close to you and you're not happy with telling them what's gone on. So it's absolutely fine. This eye here is fine. If I put a cotton bud over it like that, I've put the last bit of steroid cream on, because you're only supposed to use it for 5 days, and then I've put a little bit of bio oil over the top just to try and help it heal. But if I run a cotton bud like that, it's slightly sore, but apart from that, I can't feel anything. This eye's the same. However, here, I did just sort of gently use a cotton bud to get one last little brown scab off, and it was bleeding a little bit there, only ever so slightly. So I obviously shouldn't have done that. So I wanted to show you and say, you know, when they start coming off themselves, and you can gently get them off with like cotton. I used a cotton bud, or a cotton pad with some micellar water on, and I also before that used some 2-in-1, so it's got a little bit of oil in it, the Garnier 2-in-1 makeup remover. And if you gently just go over your eyes and it comes off, great, but don't do what I did and sort of try to force it. I think I should have left that one on until tomorrow, which will be, no, tomorrow will be day 6, I suppose, because Friday will be a week. So I'd say give yourself a week. I am hoping that when this heals, I will be able to put some eyeshadow on and some proper concealer as opposed to just mineral powder, and then try some eyeliner and things like that, you know. So still pretty impressed with it. Still really impressed with it, actually. I think it looks great. I think all the swelling has gone down, so, you know, less than a week for the swelling to go down. I don't think there's any more swelling to go down. So yeah, pleased as I can be. What I'll do next actually is I'll come back to you when I have got my makeup on, because this redness on my eyes now, to me that's nothing. As long as that little bit there heals, the redness I can cover, but I do still notice a little bit of texture. There's a little bit of an odd texture. Don't know whether you can see it when I sort of push my eye there. There's a little bit of a strange texture, which will take a while to go away. And the redness can last like up to 6 weeks for some people. That's what Dr Bong told me. So I'm not going to wait 6 weeks to do a video for you, just in case it takes that long. I thought I'd show you a little close up so that you can get an idea of exactly what it looks like. That's focused just about, hasn't it? I don't know whether you can see that little bit where it's cut just in the inner part. And then the other eye, which I think is a bit better. I think there might be some crust to come off just at the very top of each eye, looking at that closely. But they certainly don't come off very easily, so, you know, I'll wait until they come off. Just a quick update. This is them on day, nearly a week, basically. This is Thursday evening, and I had them done last Friday lunchtime, so this is them at a week. I think you can ignore this little red bit here, because I think that's just where I pulled off the brown crust before I should have done. And you can see the rest of it is healing lovely. It's just a little bit red, but easily coverable with makeup, very easily. And that bit's just a little bit sore and it's a little bit weepy. It's bleeding actually, but I can still cover it with mineral makeup. I don't know, I was thinking about doing eyeshadow tomorrow, but I'm not sure whether I can actually manage to get any eyeshadow on there or not. But yeah, this is nearly a week, so the next time you see me will probably be tomorrow morning with possibly some kind of makeup, depending on how that has healed overnight. Good morning, you guys. So this is 1 week today from when I had the treatment done, the Plexr treatment done, and this will be the last you will see of me for now. Obviously you'll still find me on my beauty channel, and I will probably talk about my eyes on there and on my vlog channel, etc. Especially when I get the second treatment, I will do a video of this is the second treatment, and I will still do before and after pictures on the second treatment and the third treatment, if indeed I need the third treatment. The way that it was explained to me was that the first treatment for me was to take away the excess skin And then after that, you could begin the tightening of the skin. But first you needed to take away the excess skin, and that he thought that would be 1 or 2. Like I said, I am going to do another video on treatment 2 and 3, but I definitely think if you can only afford the one treatment, which is £350 with Dr Bong, then you are going to get a result with that. You're not going to get no result, because I couldn't be more delighted, honestly, because even this morning, this is the first time I put makeup on. To be honest, I think I should have left it another couple of days, simply because I've got a little bit of a sore spot right there where I think I took the brown spot off too quickly. And also the texture is a bit odd. It's still, I think, probably another 2 or 3 days and my eyes will look great with makeup on, but at the moment, close up, they don't look brilliant. I'll show you them close up, of course. But even with my makeup on, I can see now, looking forward, I can see my lid, I can see the colour that's on my lid, and it had got to the point where my skin was covering that and I couldn't see my lid. So I am just absolutely delighted, so glad I didn't have the surgery on my eyes, and yeah, I would totally recommend it. Let me give you a close-up just now. This is them 1 week to the day, and you can see that I've still got, there is still loose skin here. You can see actually the difference in texture when I move it, but it's not like that. That's, I feel, how it was before, and it's now the excess skin is just tightened, and I can see the colour on my lid. You know, it's not completely covered. And this is them closed. And closed, they'll probably look more, they'll probably have some more texture, or you'll probably be able to see the imperfections more. Morning, you guys, it's Karen, and I know this is a long video already because it's 43 minutes long as I'm editing it, but I just wanted to put one more bit in to let you see 2 weeks afterwards, because the last you've seen is 1 week, and this is now 2 weeks afterwards. It's completely healed, but I wanted to tell you that between week 1 and week 2, it was a little bit itchy, and I did keep on itching it, and sometimes when I itched it there would be a tiny little blood would come out, tiny little bit of blood and tiny little bit of bleeding, just a speck of bleeding. Not anything to worry about at all, but now it is, I would say in the last probably 2 days, none of that's happened. It's 95% healed. You can still see, it's almost like tiny little indents of dots on my eyes, but I can put my makeup on without any real difference, and I still love the results. So I'll give you a close-up as well. So this is them close up, and I'll close my eyes so you can see it close up as well. Like I said, I know this is making it a very long video, but I think it's worth it because it gives you all of the information, and it's, you know, it's an expensive thing, and it's something where you're going to need to take a week off work, or, you know, kind of interrupts your life. So I think it's good that you have all of the details. So I wanted you to see it at the 2 week stage. That is everything there is to tell you for now. If you've got any questions, then please do leave them in the description below, and I will do my very best to answer them. And I'll also ask Dr Bong if there's any questions that I feel I can't answer, or he has anything to add, then I'm sure he will go on and answer that for you. I don't know that this treatment is available anywhere else in the UK. One of my viewers has said she's had it, and she is way down south. And I think there are similar treatments. I talk more about that in my other Plexr video. But yeah, I think that if you can possibly get to Glasgow, then I would recommend going to Dr Bong, of course, because I can't give you any reviews on treatments by other people, because it's definitely different. Like the person that in fact, I know 2 people that have had it done, and they've had different experiences to me, more swelling, and I don't know, Dr Bong has just, I think, made a fantastic job, and he's kind of extra cautious, but he's also very, in his words, aggressive with the treatment. So he gives you the highest level of treatment, but he gives you all of the details about how swollen you're going to be, etc., so that you actually, what happens is less than what you're expecting. I don't know if that makes sense, but certainly from a point of managing my expectations, he has exceeded my expectations, and I'm quite a fussy customer. So yeah, like I said, any questions, leave them in the comments below. I will do another video once I've had the second treatment. I'm already booked in for the second treatment, and it's 6 weeks apart. That's something I probably didn't tell you. 6 weeks apart between each treatment, which is good in terms of you can really see the difference and decide if you want a second treatment. And also it gives you, you know, the £350 every 6 weeks, as opposed to one lump sum of £1,000. Thank you so much for watching. Please let me know if you have this done, especially if you do go to Dr Bong, and I hope that you will be as delighted as me if you do go ahead with it, and I will speak to you again soon.